Hi, my name is Camby and I'll be your nurse today. I am here to assess baby. Mom, I'm going to go ahead and check your ID, your bracelet to make sure you match baby. So first thing we'll do is check and make sure you match mom, you match baby. Okay, their ID bracelets match. The second thing I'm going to do is explain to mom that I'm going to go ahead and assess the baby and make sure that baby is is within normal limits for what she should be. Is there anything abnormal that we need to find? The third thing I'm going to do is I'm going to go ahead and being in here, she's going to go ahead and cry probably pretty quickly. So we're going to do our assessment as quick and as thorough as possible. The first thing we're going to do is go ahead and wash our hands and put our gloves on. So we go wash our hands. We put our gloves on. Okay. We come over and we listen to her heart first because she's going to cry. I just want to go ahead when she's quiet and listen to her heart. So when I listen to her heart, I'm going to listen to her heart for 1 full minute. I'm going to listen to apical heart sounds. I'm going to listen to a heart rate of 110 to 160 is my normal heart rate because I'm going to be counting her heart rate while I listen. I'm going to listen for her rhythm, her rate, and any abnormal heart sounds that I hear. Okay, so we're going to listen to her heart sounds. Okay. I hear good rhythm and good rate, no abnormal heart sounds. So now I'm going to listen to her lungs since I'm right here listening to her heart. When I listen to her lungs, I'm going to listen in 5 places. I'm going to listen post or anterior, and then I'm going to turn her around and listen posterior, front and back. When I listen for breath sounds, I'm going to go to the upper right. I'm going to go left, and then I'm going to go right, left, and then right again, 5 different places. I'm going to look for any signs or symptoms of respiratory distress. I'm going to look for her chest rising and falling at a regular rate and even regular rate. Okay, so let's listen to some lung sounds. Left, right, left, and then right again. Her lung sound good, clear, and no abnormal lung sounds. Next thing I'm going to do while I'm right here is going to go ahead and listen to her bowel sounds. I want to make sure she is positive in all 4 quadrants. Okay. Positive in all 4 quadrants, and she has an active bowel sounds. So I would be looking at hypoactive and active. So she does have active bowel sounds, positive in all 4 quadrants. The next thing I'm going to do while I'm right here is take her temperature. So I'm going to take a thermometer, and then when I put the thermometer in, I'm going to make sure I don't put it this way. I'm going to go ahead and put it up long ways underneath her arm so that it doesn't go through, and then get an inaccurate reading. So I'm going to go ahead and take her temperature. Her temperature is good. While I'm taking her temperature, I'm going to look over her skin. Okay, I'm going to look for any abnormal lesions, any bruising, any abnormal coloring. I'm going to look at her to see if there's any birthmarks, anything like that. I'm also going to go ahead and look at the umbilical cord. I'm also going to look for signs and symptoms of infection. I'm going to look to see if there's any bleeding there. This is the time that I can take and teach mom about the umbilical cord, what signs and symptoms to look for, looking for infection, and while you take care of the umbilical cord once you go home. So while I'm looking at the umbilical cord and I'm looking at her skins, which I forgot to listen to the breath sounds on the skin, or on the posterior, and the heart, so we're gonna go to posterior of the right, left, and then right again. Okay, so heart sounds good while I'm over here. I'm gonna turn her over and also look at her skin. Okay, so now that we've looked at her skin, we listened to her heart, and we listened to her lungs, we're going to look, as we're looking for skin, looking at her skin, we're going to look at her scalp while I have her right here. I'm going to look at her head. I'm going to look to see if her hair is evenly distributed. I'm going to look and feel her fontanelles. I'm going to look at the anterior and posterior fontanelle. I'm also going to go ahead while I'm looking to make sure that they're soft. I'm going to make sure the lines for her sutures are in place and in proper order. I'm also going to look at her eyes. Okay, so I've looked at her skin. I've looked at to make sure everything's okay here. I'm going to look at her eyes. I'm going to see what the color of her eyes are to make sure all of her colors in her eyes are within normal limits and that she is responding appropriately for her age. So while I do that, I'm also going to look for any conjunctivitis or any kind of drainage in her eyes. While I've got her here and I'm looking at her eyes, I'm going to look at her nose to see if there's any kind of nasal flaring. I'm also going to look for secretions to see if there's any secretions. As I'm done with that, I'm going to go ahead and look at her mucous membranes. I'm going to look at her lips to see if they're pink and moist. I'm going to look at her mouth to see if it's moist and the coloration is appropriate. There's no signs of symptoms of any kind of dehydration. So next thing I'm going to look at, and I'm going to check some of her reflexes. Since I have her right here and I'm looking at her mouth and touching her face, I'm going to go ahead and make sure I have clean hands and gloves. I'm going to go ahead and do the clean finger reflex. So I'm going to go ahead and put my 2 fingers in there to see her, or my finger in there to make sure she has a sucking reflex. That's normal. And that when I take my finger out, that I kind of sweep around and then hit the top of her palate there to see and make sure that that's fused together properly and growing without any issues, that the bones there are coming together. While I do that, I'm going to look at her routing reflex. So if I swipe the side of her cheek, then she should kind of, start to suckle or start to move her cheek towards my hand. When I'm doing that, I'm also going to check her skin turgor here at her clavicle, since I have her here. When I do that, I'm going to check for pulses. So I'm going to go to her femoral pulse. I'm going to do, some brachial pulses here. We're also going to do some pedial pulses. So we've checked her pulses. We're also going to, while we're sitting here checking her pulses, check her capillary refill. So we check to make sure her cap refill is good, which she's got a nice cap refill. It's brisk and it's less than 3 seconds. We're going to go ahead and while we got her here, we're going to check her spine to make sure her spine is all aligned and everything's in alignment. We're going to look at her sacral, her bottom here, and see if she has that little dimple or any kind of hairs that are abnormal there on top or around her coccyx. We're going to do the palmar reflex. So we're going to do our, the next thing we're going to do it, we're going to check the rest of her reflexes. So we put our finger in her hand, and if she curls her little fingers over, then that's we've got good reflexes there. We're going to do the plantar reflexes. We put our hand underneath her little toes here, and she's going to curl her toes over. If she does that, that means she has good plantar reflexes there. After that, there's the Babinski, and that means we swipe the bottom of her feet here. And when we swipe her feet, her toes could kind of flare out, kind of in a, shocking response. The Mora reflex is going to be kind of, once we do that, we're going to kind of sneak over the corner. We're going to startle her a little bit. Once we startle her, her normal response should be to have a good healthy cry, and she should kind of have her arms kind of flare up. So now we've gotten to hear her good healthy cry. We've gotten to make sure that her reflexes are all within normal limits. She's moving all of her extremities. At this time, we can change her diaper before you get her finished for the day. We change her diaper. We look at it. We look at her bottom. We're looking to see, if she's a girl, if her labia and is intact and appropriate and everything is proportionate, and to see if there's any kind of discharge or drainage. If she is a male, we're looking to see if there's a circumcision. If there is, we're going to look at the site, look for infection, swelling, inflammation, or bleeding. If there is no inflammation at the site, then we're going to go ahead and look, after that, everything looks good. We're going to look at the bottom to make sure the anus is completely patent. After that, we could teach mom about diapers while we're doing this, about how originally they'll start, for, a clean or dirty diaper at a lower amount, and then they'll increase their amount, to a normal range of 6 to 8 dirty and wet diapers per day. We'll ask mom about the dirty diaper. We'll ask her about if she had a black and tarry stool, and if that's the case, that would be the meconium stool, which would mean that that's normal and that's what we would like. Then we would explain the normal progression in her stool as she, or as baby, starts to breastfeed or formula feed. We asked about the urine, what the urine looks like, what it smells like. If there's any, if there's any concern with the less or excess amount of urine, we'll then, after we do all of that, we'll change your diaper, we'll put her hat on, we'll put her little clothes on, we'll wrap her up and swaddle her, we'll ask mom if she wants to hold her, if she wants me to take her to the nursery, if she needs anything, and then explain to her where her call light is. And I think that's about it.